When it comes to health and wellness, our eyes are very important. Sponsoring our segment this afternoon is Chittick Eye Care, and with me is Dr. David Sola. Welcome back, Dr. Sola. It's good to have you here.
Thank you.
How have things been going? Last time you were with Heather, I believe you were just coming into town.
That is correct. Things have been going great so far. We've been extremely busy. I started seeing patients February 1st, 2024, and we've been very, very successful. We've seen over 1,300 patients in the last 3.5 months at Chittick Eye Care in the ophthalmology clinic, and done a lot of surgeries, a lot of procedures, helped a lot of patients. So I'm very excited. It's been going great.
That's awesome. Now, you're an ophthalmologist.
Correct.
Your specialty is in cataracts and glaucoma.
That is correct.
You're a surgeon. Give folks, remind us a little bit about your background and kind of where you're coming from.
Yeah, no, absolutely. So I basically went to Harvard undergrad, and then I went to Columbia for medical school. Then I went to Harvard Medical School for my residency, and I did my glaucoma fellowship at Bascom Palmer, which is the #1 eye institute in the country. And the last 7 to 10 years, I've been in Boston. I was an assistant professor at Harvard Medical School, and I basically did surgery at Mass Eye and Ear. I was a very busy clinician and surgeon there in the glaucoma department. And I moved here February 1st, essentially, and I've been here the last 3.5 months.
That's incredible. And I know that you've been a part of some pretty cool research projects over the years, and you're still involved with a lot of research projects, really just at the cutting edge of where technology is going and where the field is going.
That is correct. Yeah, I was very fortunate at Harvard. I ran a clinical research lab. I had 12 people under me there, and we've published over 40 articles the last 7 years on all things glaucoma and cataracts. And I'm very excited that I get to continue doing some of that here. I'm an associate professor at the Carl Illinois College of Medicine, and I already started working with the medical students here. So I'm excited that I get to continue some of that work here in Illinois.
That's cool. And I understand you're actually volunteering your time. You just got your time. You're volunteering on the weekends, helping with the students at some of these eye clinics that they offer over the weekends.
So the College of Medicine has a school program where they help indigent patients who don't have insurance get basic eye exams, and we're going to start working with the medical students this summer, and I get to volunteer some Saturdays and Sundays with the medical students, and I'm excited about that. I think it's really important not only to teach the medical students, but to help patients who may not have, insurance or the benefits that other patients have.
That's incredible, and I'm sure it's greatly appreciated, because when you can't see, there's nothing good about that.
Exactly, of course, of course.
Now, speaking of such, let's talk about routine eye care and why it's so critical, especially coming from your perspective.
Oh, absolutely. I think it's incredibly critical because there's so many eye diseases that don't have symptoms until they're very late in the game. One of them is glaucoma, which is one of my specialties. It's a silent disease. A lot of patients have 0 symptoms for many years, and ideally you want to catch it early and treat it early so you have a really good result and you get to retain your vision. And I can list other diseases like macular degeneration, even dry eye. 80% of the population has dry eye and has a huge impact on the quality of someone's vision. But until you go to the eye doctor, you really can't get diagnosed appropriately and get the care you need.
Right, and some of that kind of creeps in over time. So you may be like, hey, I saw the eye doctor a few years ago and I was fine, but stuff like that can kind of develop over time.
Absolutely.
What are some of the risk factors? And I know you said some of this, you don't even notice the symptoms, but what are some of the risk factors that when it comes to glaucoma or cataracts that people should consider?
Yeah, no, absolutely. I mean, cataracts, I tell patients, everyone past the age of 40 has some degree of clouding of the lens. There are things like trauma and other medications that can cause cataracts earlier even. Actually, I've done cataract surgery in 20-year-olds, some unlucky 20-year-olds. In terms of glaucoma, family history is a big thing. If you have any person in your family, mom, dad, siblings that have glaucoma, you should definitely get checked. But a lot of my patients actually don't even have a family history. I tell patients it's a silent disease. The only way to figure it out is to go get checked, and to get checked at least once every year, once every 2 years, to make sure that your pressures are normal and that it's okay. There's some races that have higher risk of glaucoma. Hispanic patients, African American patients, I tell them to get checked. Age is a risk factor. Anyone past the age of 60 should be getting checked regularly. That's a risk factor for glaucoma. And there are a lot of other risk factors, but really I think the key message here is don't think that because you're seeing okay, you're okay.
Yeah.
You really need to get checked and make sure that we're not missing anything.
Seeing your doctor is the first step. And so Chittick is a great place to do that. And we do appreciate Chittick Eye Care for sponsoring our segment today. If you want to learn more about Dr. Sola and the services he's now bringing to patients here in Central Illinois, just head over to ciLiving.tv.